Senator from Vermont.
I do disagree with my friend from Oklahoma very much, but that disagreement will have to wait for another day, because today I want to deal with another crisis, and that is the situation regarding health care. And, Mr. President, I come to the floor to urge my fellow senators to go forward in passing the strongest possible piece of health care reform legislation which is comprehensive, covering all basic health care needs, legislation that is universal, covering every man, woman, and child in our country, and legislation, importantly, that is cost-effective, both for individuals and for our nation. Mr. President, I think all of us understand that the United States today is in the midst of a major health care crisis. 46 million Americans have no health insurance, and importantly, even more are underinsured with large co-payments and deductibles. The sad reality is, Mr. President, we've heard some of our right-wing friends talk about death panels. Well, let me tell you about the reality of a real death panel, not a phony death panel. And that is that this year in the United States, according to Harvard University, some 45,000 Americans will die because they lack health insurance and they don't get to a doctor when they should. 45,000 will die this year, and if we don't take action, 45,000 or more will die next year. This is the United States of America, and to see tens of thousands of our fellow country people dying because they don't have access to a doctor is an abomination. It is not acceptable, and that needs to change. Among many other reforms that we need to bring about as we go forward with health care reform is a revolution in terms of primary health care. Today, 60 million Americans, including many with health insurance, do not have access to a doctor, and the result of that is that when they get sick, they go to the emergency room at great cost, or they delay getting health care and they end up in the hospital being treated for a far more serious illness than they would have had if they were treated initially. Clearly, this is an absurdity. It costs us lives, it costs us money, and we have got to change that. I am very happy to say that in that regard, I have introduced legislation that has 25 co-sponsors in the Senate and which has been incorporated into the Health, Education, and Labor Bill, which would quadruple the number of federally qualified community health centers in our country over a 6-year period, which would mean that there would be a community health center providing excellent quality health care, dental care, mental health counseling, low-cost prescription drugs in every underserved area in a country. We go from about 1,300 centers to 5,200 centers. And we would also, in this bill, increase by 10 times the amount of money for the National Health Service Corps so that we can pay the debt forgiveness, we can provide debt forgiveness for those people in medical school who want to practice primary health care, of which in Vermont and around this country is a desperate, desperate need. We absolutely need to increase the number of primary health care physicians that we have. Mr. President, when we talk about health care reform, we have also got to include dental care. Dental care is sometimes pushed aside, but I can tell you that in many regions of this country, people are finding it virtually impossible to gain access to a dentist, and oftentimes they simply cannot afford the dental care that they need. So when we talk about health care, we've got to include dental care in that. And furthermore, when we're talking about health care reform, it is absolutely imperative that we begin to address the fact that in the United States of America, we spend far more on prescription drugs than do the people of any other country. And this is not just a financial issue for the individual. This is a health care issue. I have talked to physicians who tell me, and I think this is common not just in Vermont but all over the country, that some 25 to 35% of their patients do not fill the prescription that the doctor is writing because they can't afford to do that. So what sense is it when somebody goes to the doctor writes out a prescription, but that individual cannot afford to fill that prescription? So we need to deal with the high cost of prescription drugs, and we can do that in several ways. Number one, when I was in the House, I was the first member of Congress to take American citizens over the Canadian border to purchase prescription drugs there that cost a fraction of what they cost in the United States. So we need to pass what's called reimportation, the right of Americans and the right of prescription people who manage prescription drugs, who are in that business, to be able to purchase safe, FDA-approved medicine from abroad at a fraction of the price that the drug companies are selling those products to them in this country. That will lower the cost of prescription drugs for all Americans. Second of all, we obviously have got to negotiate prescription drug prices on the Medicare Part D. And when we do that and we lower the cost that Medicare is paying, we can end the donut hole, which is now causing so many problems for senior citizens today who go above the first part where Medicare is paying about $2,500, then they've got to pay 100% of the cost, which is really hurting a whole lot of seniors. Thirdly, we must deal with the biologics issue. My colleague, Senator Sherrod Brown of Ohio, has been very strong on this so that we stop drug companies from having exclusivity for 12 years, preventing generic companies from getting into the market and lowering the cost of biologics. That's a very important issue. Mr. President, any serious health care reform legislation must include strong cost containment. Insurers have increased premiums 87% over the past 6 years, while premiums have doubled over the last 9 years, increasing 4 times faster than wages. If present trends continue, health insurance premiums will double over the next 8 years, which will be a disaster for millions of Americans and, in fact, for our entire economy. Today, the United States spends far more per capita for health care than any country on earth. And that is a very important point for us to understand. We are now spending over $7,000 per person. And yet, despite spending almost twice as much as any other industrialized country, our outcomes in terms of infant mortality, in terms of life expectancy, in terms of immunization and preventable deaths is often behind other countries. So we are spending huge amounts of money. We're not getting value for what we are spending. The cost of health care in this country is now 16% of our GDP, and it continues to soar at a rate that is basically unsustainable. So this is not, again, just an issue for individuals. This is an issue for our economy and for our nation. If you look at a company like General Motors, which went bankrupt, was spending more money on health care per automobile than they were on steel. Small business owners in Vermont and across this country are finding it harder and harder not only to provide decent health care coverage for their workers, but in many instances, they can't even provide health care to themselves. And what ends up happening is instead of investing their profits into expanding their businesses, into creating more jobs, all of that money is going into the soaring health care costs. But when we talk about the personal impact of our disastrous health care system on individuals, there's no better example than looking at bankruptcy. In this country today, we have approximately 1 million Americans who are going bankrupt because of medically related costs. Not hard to understand why. You lose your job in the midst of a severe recession. Somebody in your family becomes very ill. Well, how do you come up with the money when you don't have any health insurance? Or even if you do have an inadequate health insurance program? Well, the answer is you go bankrupt. So incredible as it may sound, close to 1 million people in this country this year are going bankrupt because of medically related illnesses. Now, Mr. President, I've talked a little bit about some of the problems that are out there, and there are many more. What's the answer? Well, I don't think anyone has a perfect answer, but I do think that the United States should be looking at other countries around the world. Why do we end up spending so much and get relatively poor value for what we are spending? And I think when we do that, when we look at countries throughout Europe, Scandinavia, Canada, and so forth, I think it leads one to the conclusion that if we are serious about providing quality, affordable care to all Americans in a cost-effective way, then we must move toward what many of us call a Medicare for All single-payer program. Now, I understand, as I think many people do, that because of the power of the insurance companies and the drug companies and the medical equipment suppliers, because of their campaign contributions, because of their lobbying, the truth of the matter is that a single-payer program has never been on the table from day one since this whole discussion began. And I think that that is very, very unfortunate. And it's doubly unfortunate because we have many, many thousands of physicians in this country, including the 16,000 members of Physicians for National Health Care, other health care providers, the largest nurses union in this country, in support of a single-payer system. Millions of Americans want us to move that way, but because of big money interest, that discussion doesn't even begin to get to the floor. Well, I intend, during the course of the debate, to offer an amendment on a national single-payer system. We will see how many votes we get. But what I am also trying to do is to give states flexibility so that if they so choose, they can move forward with a single-payer approach. My guess is that if one state does it, whether it's Vermont, California, Pennsylvania, whatever that state may be, that if it works well, if everybody in that state has good quality health care in a cost-effective way, it will spread all over the country, and I intend to do my best to see that language is in the bill which will allow states to do just that. Mr. President, a single-payer national health insurance program is a system in which a single public or quasi-public agency organizes health financing, but delivery of care remains largely private. This is not a government health care program. It's not what they do in the United Kingdom. It is public insurance privately delivered. The reason we spend more, and this is an issue that has gotten an amazing little discussion. Why do we end up spending almost twice as much as any other country? Well, I think that's a good question to ask. I don't hear a whole lot of answers. And the reason is that we have a patchwork system of for-profit payers. We have private insurance. What is the function of a private insurance company? Everybody in America understands. The function of a private insurance company is not to provide health care. It is to make money. And what we end up with are 1,300 private insurance companies with thousands of separate systems, each geared to a different group, each geared to make as much money as it possibly can. And the result is that we as a nation are spending about 30 cents of every dollar, not on doctors and medicine and nurses. We're spending it on administration and bureaucracy, huge profits, advertising, billing, sales, marketing, you name it. We spend it rather than spending it actually on trying to keep people healthy or make them well. Single-payer financing is the most significant way that I know to end the waste and bureaucracy of the current system. What the studies suggest is that if we move toward a single-payer system, we would save over $350 billion every single year, getting rid of all of that bureaucracy, that waste, the paper shuffling that has nothing to do with making people well. Under a single-payer system, all Americans would be covered for all medically necessary services, including doctor, hospital, long-term care, mental health, dental, vision, prescription drug, and medical supply costs. In other words, unlike anything else that I've been hearing, it would be comprehensive, all of your basic health care needs. Patients, of course, would remain free to choose the doctor and hospital that they would want, and doctors would retain autonomy over patient care, which often is not happening today, as they have to argue with insurance companies as to what kind of therapies they can prescribe. Mr. President, physicians would be paid fee-for-service according to a negotiated formulary or receive salary from a hospital or nonprofit HMO group practice. Hospitals would receive a global budget for operating expenses. Health facilities and expensive equipment purchases would be managed by regional health planning boards. A single-payer system would be financed by eliminating private insurers and recapturing their administrative waste. Modest new taxes would replace premiums and out-of-pocket payments currently paid by individuals and businesses. Costs would be controlled through negotiated fees, global budgeting, and bulk purchasing. Well, Mr. President, that is where, in my view, we should be going. That is not where we will go. As I said earlier, that approach is anathema to the insurance companies, to the drug companies, to the medical equipment suppliers, to all of the big money interests. And they have, unfortunately, enormous power over what goes on here in Congress, so we are not going to go there. Now, let me just say a few words of where we are going, and obviously we are in the middle of that right now. The House last week came forth with their bill. Senator Reid, Majority Leader Reid, is now trying to meld the two bills here in the Senate from the Health Committee and from the Finance Committee, and we expect that that new legislation will be out very shortly. I have not seen it. I don't know that anybody has. But let me just say a few words of concern about what I have seen in the discussion and the legislation that has been passed in the Senate. First of all, the average American, and I get this in Vermont every day, and I'm sure you get it in Maryland every day, Mr. President, is people can say, all right, hey, good, health care reform, that's great. What's it going to cost me? Hey, what do I get? How much am I going to have to pay, and what do I get for what I pay? That is the question on the minds of millions of Americans. And the answer is, at this point, and again, we have not seen Senator Reid's bill, which will be out almost momentarily, but let me just tell you about what was in the finance bill, the Senate finance bill, so everybody has a sense of what we're talking about. Under the finance bill, and that's going to change, that is going to change, whether it goes up and down, I don't know, but it will change. A family of four in Vermont earning $44,000 a year, which is not an unusual sum in my state, would pay about $3,087 in annual premiums, while the federal government would pick up the rest of the total of $14,700 in premiums. And in a year with high medical expenses, in other words, somebody gets ill, somebody has an accident, you end up in the hospital for 3 weeks, that family would pay up to $5,800 out of pocket. So you got premiums of $3,087, out-of-pocket cost of $5,800. That is a total potential payment in premiums and out-of-pocket expense of $8,887 for health care under the Finance Committee's bill. This would be about 31% of the net income, after-tax income, of a family in Vermont, and I don't know if Vermont is any different than Maryland or any other state, earning $44,000. 31%. Now, Mr. President, somebody could tell you that's health care reform, but I really don't see it. Asking people in this country who admittedly have a tough year with illness to pay 31% and say, hey, we passed health care reform, that frankly is not good enough for me, and I am going to do everything I can to make sure that the final product out of the Senate is a lot better than that for ordinary middle-class families. Second issue that concerns me as we proceed down the line in terms of this health care debate is the issue of public option. I think there's a lot of confusion about what a public option is. But let me say this. My belief is that the vast majority of the American people want to have a choice as to whether or not they stay in a private insurance company or they go into a Medicare-type public option, which is funded by premiums. It's not Medicare. It is funded by premiums. But there are large numbers of Americans, for right reasons, I agree with them, they do not trust private insurance companies because they understand that a private insurance company wants to make as much money as possible off of their premiums. They would like the choice of looking at and maybe going into a public option. My view is we should make that choice available to as many people as possible. And I have the sad thought that many folks out there are hearing us talking about public options. Hey, that's great. I'm going to have a choice. I don't like my employer-based health care bill now. I'm going to have a public option. That's great. Well, let me break the bad news to you if that's what you believe. That ain't the case as it now stands. Relatively few people who are currently uninsured, small, very small businesses, people who today get their insurance companies privately for themselves or their families, self-employed. Those are the people for whom a public option is currently available based on what's been passed. I think that's wrong. I think we have got to expand it. Frankly, I think virtually every American should have that choice. You know, there's great debate. Should members of Congress have the public option? Our right-wing friends are talking about, yeah, we should. And if a public option is better than private Blue Cross Blue Shield or private insurance companies, many of us would take it. But like everybody else, we deserve the option. That's what it is, an option. If you like private insurance, it's working well for you, stay with it. You like the public option, it's better for you, you go with it. Let's give as many Americans the choice, not 2%, not 3%, but the vast majority of the people in our country who now are in private insurance. And that takes us to another issue because in the midst of a bill which is very, very complicated, and I'm not a great fan of complicated. I think when you have a bill that's 1,900 pages, that just begs for the big money interest and the special interest to get their little things in it, and I worry about that a whole lot. This is much too complicated, but there it is. I think the House bill was 1,900 pages. But when we talk about opening up the public option for more Americans, it means to say you got to open up the exchange, the gateway for more Americans. And the gateway means that if you choose either your private insurance company or a public option, you're going to get subsidized by the federal government. Right now, as this bill stands, there are many people stuck in bad private insurance plans. Maybe you work for Walmart, maybe you work for Dunkin' Donuts, maybe you work for McDonald's, and they're offering you some kind of insurance program which either costs a fortune or it doesn't cover very much. Well, you know what? Under this legislation, up to now at least, you're stuck there. That's what you got. Well, that's not health care reform to be stuck in a bad Walmart plan. We've got to do better than that. So we want to expand that gateway for more people. Now, the other question is, I don't know what Majority Leader Reid's bill is going to end up costing, but the estimates are that we're looking at about, over a 10-year period, $800 billion to $1 trillion. Well, simple question is, where's the money coming from? Where's the money coming from? There are some people who have said that, well, maybe we want to tax good, strong insurance programs out there. That's the way to go. Well, not for this senator, it's not, and I'll do everything I can to oppose any movement in that direction. Workers have fought, in many cases, long and hard, given up wage increases in order to get decent health insurance programs for their families, and now we're going to tax them? Not me. I'm not going to do that. This country has the most unequal distribution of income and wealth. Rich are getting much richer while the middle class is shrinking, and I think it is fair, as we move forward in health care reform, to ask the wealthiest people in this country to start paying their fair share of taxes. There's another issue, which is kind of a local issue, I admit, and that is on the impact on early acting states in terms of Medicaid reimbursements. It was just in the newspapers today, and I'm very proud of this, that for whatever it's worth, according to some group, the state of Vermont is now the healthiest state in the country. And what that tells me, and what I know for a fact, is that Vermont, which is not a wealthy state, has said that we are going to take care of our kids. We're going to make sure that as many kids as possible are involved in what we call, our S-chip program is called Dr. Dinosaur. It's a very good, popular program. We're going to have other public health insurance programs. We're going to do the best we can. And I'm proud that Vermont today was acknowledged to be perhaps the healthiest state in the country. And you know what, Mr. President? I am not going to sit by idly while Vermont and Massachusetts, another state that has made major steps forward, are penalized in terms of Medicaid reimbursement rates. Because we have done the right thing is not a reason to penalize us. All right, I am all for helping out states that have not done the right thing. But you should not and will not penalize states that have done the right thing. So let me conclude, Mr. President, by saying this. This country faces a major crisis in health care. Because of the power of big money, we are not going to do the right thing and pass a Medicare for all single-payer approach, which is the only way to provide quality, affordable, cost-effective health care to all Americans. What we now are looking at is a 1,900-page bill, which is enormously complicated, which clearly has been heavily influenced by the drug companies, by the insurance companies, by every other special interest that is making billions off of health care. And I think it is very important as we proceed down this path to take a very, very hard look at the end of the day as to what this bill will mean for middle-class families, for working-class families, and for the financial stability of our country as a whole. And I'm going to do everything that I can to make sure that this bill is something worth voting for. So with that, I would thank you for your indulgence and yield the floor.